Welcome back to my channel. My name is Aamna. I'm a fourth year veterinary student, and in this video we are going to talk about the pregnancy toxemia, which is a very important and a burning topic as well. So as the word indicate, pregnancy means during the pregnancy this abnormality or metabolic disorder occur. So what is the toxemia? The toxins in the blood. So certain toxins are accumulated in the blood, and these toxins are the byproduct of the fate metabolism, and that is ketone bodies, right? Ketone bodies are accumulated in the body and in the blood, so they cause disturbance in the normal functioning of the body. So let's talk about this in a further details. These are the synonyms of this disease. As you can see, pregnancy disease, twin limb disease, limbic sickness, kidney sickness, ovine ketosis, and limbic or kidney paralysis. Introduction. As the introduction mainly indicates that the principal cause of disease is a low glucose level in the body of an animal. When the animals, most commonly when the animals are multiparous, giving the birth to giving multiple births, right? So multiparous animals, so at the last trimester their glucose level become very low in the body. They cannot handle it. So while in the case of the low blood glucose level, that is a hypoglycemic condition in the body. So the body is going to make the glucose other from other sources like the fat. When the fat is going to be metabolized, the end product are the ketone bodies, acetoacetate, butyrate. So these are certain ketone bodies, 3-butyrate. These are certain ketone bodies which are accumulated in the blood, and they cause certain toxins. So it is a highly fatal and a very burning issue nowadays in the animal stock as well. So it is a highly fatal and metabolic disease because metabolism of the animal is going to be disturbed, and it is initiated by the negative energy balance, right? So let's discuss about what is the negative energy balance. When the input, right, means the requirement, the animal's requirement is higher, while the animal is having a very low energy in the body, right? Means output is very high, but the input we are giving to the animal or the requirement is very low, right? So therefore the negative energy balance is going to be occurred in the body of an animal, which causes this disease in the animals. So most commonly it occurs in the late pregnancy, and due to the excessive lipid metabolism, when the fat is going to be metabolized excessively, so the ketone bodies, which are the byproduct or the end product, they are going to be accumulated in the body, so they causes the ketonemia, and the ketonemia is also the toxemia as well. After some time, it mainly affect largely on the hepatic cells. Means liver is most commonly affected, and it causes hepatic lipidosis as well. So it also occurs due to the less glycogen content of the body in the body of an animal. So there are certain types of the pregnancy toxemia. Primary pregnancy toxemia is due to the fall of the plane of the diet in the animal. When the animal are not provided with a sufficient diet, so they are going to be have a less glucose carbohydrate level in the body. So it mainly causes the primary pregnancy toxemia. Fate pregnancy toxemia is not indicated by, or is not occurred by the stress, right? But it is due to the pressure on the rumen side and on the intra-abdominal fat, right? On the when the rumen and the uterus are exerted by certain types of pressure, right? The volume of the rumen increases due to due to anything like the due to the fat accumulation, yeah, due to the lipid accumulation. It causes the exertion of the pressure in the fetus. So that also causes a fate of pregnancy toxemia. Another reason is secondary starvation brings toxemia. When the animal is having no food at all, that causes starvation. And for secondary pregnancy toxemia, which is most commonly due to the diseases of an animal, or we can say that due to the sporadic diseases or due to the parasitic infestation inside the body, which most commonly engulf all the energy, all the glucose level inside the body, and uh, the animal is remain with nothing at all. On the fifth, stress pregnancy toxemia due to the sudden change in the weather or to the transportation, the animal are predisposed to have a less glucose level, which cause the stress pregnancy toxemia. Let's talk about the predisposing factor, which are the factor which ultimately leads the animal towards this metabolic disorder. So one number at the one most important for foremost thing is that inadequate nutrition. The animals are When the animals are having less nutrition, over condition is when there is a body condition scoring, BCS, body conditioning score. So it should not be more than 4, or not it should not be less than 4, right? When the animal are more than 4, that also causes the PD, pregnancy toxemia. When there is a under condition is, that also causes the pregnancy toxemia. Large litter size, when the animals are multi-parous animal, giving the multiple births, so that also causes the less glucose level in the body. Lack of the exercise, aging, severe parasitism inside the body, any illness in the system of the animal, and stress, due to the stress. So these are certain predisposing factors which ultimately cause the pregnancy toxemia in the animals. When If we see that when the animal is having a pregnancy toxemia, what the signs they will show, they will be separated from the flock, right? When the animals are living peacefully, happily with their partners, with their neighbors, but ultimately a farmer or owner will see that the animals are separated from their flock. So this is also the sign that animal is having a disturbance in the side of body. Then you have to move forward the diagnosis, and when you will diagnose it, you will find that the animal is having a less glucose level, the blood is having a higher amount of the ketone bodies, and that indicate that the animal is having a pregnancy toxemia. The animal will have a depression at all. When the depression is there, loss of appetite is automatically there, right? Wool pull. If we talk about the sheep is having a wool. Wool will be automatically pulled from the skin, right? And it is easily plugged from the skin as well. If we talk about the pathogenesis, how the diseases occur inside the body, so here you can see, starting from here, feed intake does not meet the energy demand. Whatever the animal is eating, here is a goat is eating forages, but it is not fulfilling the energy demand inside the body. The This goat is having three birds, three animals, yeah, three childs inside, three kids inside the body. So it is not fulfilling their demand. Ultimately, insufficient ruminal production of propionic acid, a precursor of glucose, is producing, right? Propionic acid, which is a precursor which help to form the glucose, which is not synthesized in a proper amount, then ultimately which causes hypoglycemic condition inside the body. Low glucose sugar will be there. The low blood sugar makes metabolize fatty acids, glycerol, and supplies. What happened when there is the condition of hypoglycemic condition? The animal will make the glucose from other than carbohydrate source. The animal will utilize the glycerol conditions or the fatty acids, and when the fatty acids and the glycerol oxide to form acetyl coenzyme A. And when there is the excess amount of the acetyl coenzyme A, it converted into the ketone bodies, right? It ultimately converted into the ketone bodies. And when the ketone bodies are a lot inside the body, that causes a ketosis, right? So the ketoses are present in the body of the animal, they are present in the blood as well. Therefore, they also causes a ketonemia, but they are also excreted in the milk and the urine of an animal, right? So you can see that this is a simply pathogenesis through which this disease occurs, this metabolic disorder occurs in the animal. If we talk about the sign and symptoms in the animal, so you can see here, animal will have a lethargic conditions, animal will not feel good at all, teeth grinding, you can feel a sprouting smell from the animal's body as well, and jumping of the jaws, muscle twitching, staggering gait. The gait The posture, normal posture of the animal will not be a normal looking, floating of the mouth, stargazing posture. What are the causes? If we talk about the causes of an animal, the principal cause of pregnancy toxemia is low blood glucose level, and the onset of the disease is often triggered by one of the several types of stress, including nutritional or inclement weather. The disease is most prevalent in infants and boys carrying two or more lambs or kids. If we diagnose, so we can diagnose easily by multiple things. We can take the history by seeing the symptoms, and by testing the laboratory we can take the blood, urine, and the blood, urine, and the milk as well. We can see the glucose level and the level of the ketosis as well. We have to adopt certain preventive measures to stop this metabolic disease. We talk about the treatment. So the treatment is very simple. We have to provide the electrolytes to balance the glucose level. We have to provide more than 5%, and corticosteroids are also given, and the trebolone acetate, triamcinolone, and oral therapy, propylene glycerol, and glycine. These are certain medications which are most commonly given when the animal is having a pregnancy toxemia. And you can use also your traditional ways to balance the glucose level as well in the body. So subscribe to my channel, and thanks for watching this. Meet you in the next video.